everyone. Welcome back to Face It with Dr. G. I'm Dr. G, and I'm so excited to be back with you today. We've had so much amazing support and downloads of our podcast specifically, so here we go again with another amazing episode. And today we're going to talk all about collagen. And as many of you probably are aware, collagen is a major constituent of our extracellular matrix in our dermis that keeps us youthful. And over this past several years, and even more than that, up to 10 maybe, but recently within the last 2 to 3 years, we're really changing the way we approach rejuvenation and maintenance. And this is through stimulation of collagen. How do we prevent its degradation, and how do we encourage proliferation and production of collagen by enhancing fibroblast activity? So I want to go into even more than that, because we know that we have collagen and we know that it's produced by fibroblasts, but let's get into a little bit more. So how and what are the factors? What are the cytokines? What are the chemical signals that stimulate those cells, those fibroblasts? What can we do to prevent degradation? How can we quantify collagen? How do we quantify it grossly, which means clinically by the naked eye? How do we quantify it histologically or microscopically? And as a dermatopathologist, you guys know that's right up my alley. And we're going to go into the ins and outs of the degradation and what we can do to prevent degradation and how we can stimulate that collagen production. So let's get started. So after the age of approximately 20, everybody's a little bit different. We lose about 1 to 1.5% of our collagen each year. And that creates us the appearance of quote unquote aging. And I do believe that aging is a privilege. I think it's incredible to be able to age, but how do we want to do that? And everybody has their own choice of how they want to age. And that's the beauty of it too. You don't have to have any interest in any injectable your entire life, or you can be a little interested, or you can go overboard, and we don't like that either. So whatever works for you, and I'm here to educate you on all of the reasons why. So I want to talk a little bit about chronological aging versus photoaging under the microscope and clinically, because those are two very different things, and collagen plays a role in both of those. But what are they? So chronological aging is numerical aging. That's what happens when we age day to day, and it's irrespective, or when we speak of this, it's dissociated from photoaging, which is the aging we see, the clinical and histologic picture we see of aging from UV rays from the sun. So chronological aging is under the microscope. Well, let's talk about what you look like clinically. So people typically have healthy appearing skin that has some mild sagging folds or wrinkles, but their skin overall is healthy appearing. And under the microscope, histologically, there's a certain picture of healthy aging or chronological aging, and that is you have a normal stratum corneum, so that top layer. You have a thin epidermis, and you have a loss of the undulations or the reedy ridges that we see in the epidermis. And your dermis is thinner, and that's because you've lost collagen and elastin. It's just wispy strands of collagen and elastin that appear spaced out, and the dermis appears thin. So in contrast with photoaging, we get these effects clinically and histologically from UV rays. If we're not wearing our sunscreen and we're not using retinol, we get photoaging. And clinically, this is a very different picture. You see patients and people that are brown. They have that darker, thicker, leathery appearing skin. Typically, lines or wrinkles that are deeper, you can call those rhytids, and histologically, the picture is very different. So instead of a normal appearing superficial stratum corneum, it's actually now really thick and compact. And the epidermis is actually thicker, so it's called acanthosis, widening of the epidermis, because the sun has damaged those cells. They're trying to protect themselves. So you have thickening of the epidermis, and the dermis itself doesn't look like normal collagen and elastin that's just thin and wispy and has been lost. It's called solar elastosis. It's thick, abnormal elastin specifically that has become overproduced. It's thick, disoriented, and the collagen the same. They're very disorganized, and you can also get the appearance of what's called a Gren zone between the epidermis and the dermis from the sun damage. So keep in mind that everyone ages differently, and we talk about retinoids and sunscreen, and there is some belief that retinoids have a better impact and preventative measures for chronological aging than for photoaging, even though it can help for both. But it's important to understand collagen is affected in both types of aging, and everyone's going to age differently with different percentages of chronological aging and photoaging. So collagen starts as it's procollagen, or it's called tropocollagen, when we are being formed in utero. And that tropocollagen it polymerizes into all of the other different types of collagen that we have. And I am someone who likes to know why a word is spelled the way it's spelled and what parts of the word mean. So colla, K-O-L-L-A, actually means glue. And when we talk about collagen, when we talk about collagenous materials, we think of them as almost gel-like materials. And there's a reason for that. So collagen normally, when it's in its steady state, is white and wispy and fine. And when it's heated, it becomes gelatinous. And that's also why we call it collagenous. And it's almost like a gel base, like a glue. So colla is Latin for glue. And I think that's really cool because it helps you remember things when you understand the prefixes and suffixes and what the word is, right? We all know a little Latin, especially in medicine. So now let's talk about methods of identification, both histologically or microscopically and grossly to the clinical eye, specifically on how much collagen we have and how do we identify it. So there are several different ways under a microscope you can identify collagen. You can do that with your eyes and using just a basic stain that is standard for all cases per se. So it's a hematoxylin and eosin stain, and you can identify collagen that way. If you want to get a little bit more specific, you can do special stains, and the one that we use in dermatopathology is the trichrome stain, and collagen is bright blue. If we want to do further studies like immunohistochemistry, this analysis is when it's another stain, but it's a specific antibody. And there are antibodies that have been developed to different types of collagen. So you can get even more specific with which type of collagen is present, which is so super cool. Other ways that you all may be familiar with, I'm not going to get into the nitty-gritty of these, are analyses like ELISAs and Western blot analysis that you see in typical laboratories. You can also do in vitro analysis and culture and grow fibroblasts and treat them with different chemicals and substances to see how they react and how the collagen production is altered. You can do radio labeling, and you can also use high frequency ultrasound, which you guys know is one of my all-time favorite new techniques and machinery that we use in aesthetics. So now let's get into collagen degradation. And as anything in our body with cellular turnover, collagen does the same thing. So we're constantly producing collagen and degrading collagen naturally in our bodies. Other insults that cause that degradation are obviously things like ultraviolet radiation, which we want to prevent and protect ourselves. So our natural collagen is relatively resistant to kind of generic insults. However, when we have damage from UV rays, we do have activation of enzymes that I think we hear in the aesthetic medicine field often. They're called MMPs, or matrix metalloproteinases, but I'm not sure we all know exactly what they do. So specifically, MMP1 and MMP3 are activated by ultraviolet radiation, and those MMPs directly degrade our collagen. So not only does UV radiation activate these enzymes, and MMPs are a huge family of enzymes, so the ones that I'm specifically referring to are MMP1 and 3, but UV radiation also directly inhibits the production of type 1 collagen itself. So you're getting hit from both directions. Okay, one other cytokine that's super important, again, that I feel is thrown around in aesthetics, and we're just really not sure of what it does, is TGF-beta, so transforming growth factor beta. And we hear a lot about growth factors, but this specific one is very integral to collagen synthesis, and it helps with differentiation of fibroblasts and induction of the synthesis of collagen. Something interesting about TGF-beta is that TGF-beta inhibits the proliferation of keratinocytes and induces the proliferation of dermal fibroblasts. So we can now conclude that's how those fibroblasts that are proliferating are going to produce more collagen. Again, all of this varies on so many different factors, specifically the concentration of fibroblasts that you specifically have, but that's wonderful. So directly stimulating fibroblasts, awesome. TGF-beta also inhibits the MMPs, or the matrix metalloproteinases. So TGF-beta helps stimulate the fibroblasts, inhibits the MMPs, so everything is going towards an increase in collagen production. So how does UV radiation play here with TGF? So we know that UV radiation activates the MMPs that break down collagen, and now we know that UV radiation inhibits the action of TGF-beta. So UV is bad. That's why you have to wear your sunscreen. Okay, so how do we improve our production of collagen, or how do we prevent the degradation? So obviously sunscreen. We all know about vitamin A derivatives, the retinoid family. We have retinol and we have tretinoin, both very distinct ingredients and chemicals that work differently but get to the same endpoint. And I'm going to do another podcast all about the details of the vitamin A family and the retinoid family. But retinol and tretinoin, they stimulate collagen, and they do that specifically by inhibiting the MMPs. So that's interesting as well. We can also do things like microneedling, radiofrequency microneedling, gentle chemical peels, using peptides on our skin topically. And I get asked a lot, and my team does as well, do collagen supplements work? And I personally don't think they can hurt you. I think they have a lot of benefits, full body-wise. Bodily, your collagen is used by every single organ in our body. And I believe that if we're ingesting collagen supplements, it's pretty much going to be used by every other organ first before it gets to our skin. It doesn't mean it's not going to get there, but I don't think it's the end-all be-all when it comes to maintaining your collagen concentration. I think it can help. I don't have an exact answer, but that is my conclusion. So I hope this helped. I hope you learned a little bit more about collagen and how it works and where it comes from and how you can quantify it under the microscope and everything in between. Like, subscribe, listen, share, all of the things on social media. I love hearing from you guys. This has been such a blast, and I'll see you guys soon.